we talked about the low carb Mediterranean diet being a good, at least starting place for your average person that wants to start regulating their blood sugar. Let's talk about specific things people can take or do. Say they're following that diet day to day, but it's the weekend and they're going to go out to dinner with friends and maybe have a little bit more carbs than they usually would. What are some things, knowing they're going into that situation, they could bring with them and take or do afterwards to help control the blood sugar? And I want to caveat this. This isn't just so people can go out there and abuse what they're eating, but people that are being conscious and they just want to regulate within a more narrow realm when they quote unquote cheat.
Yeah, I guess, you're referring to like going eating outside and things like that, or what they can do.
Just, simple things such as going for a walk after the meal or before the meal.
I see. Yeah.
Simple things
Right.
that they can include supplement-wise or
Yes.
different things as they're eating to
Right.
help keep the blood sugar under control.
Definitely. So, to the point, remember we talked about the marathon example? If you're gonna go for a marathon, go eat your cereal. I don't care, right? Because you're gonna burn it off. Yeah, so I do the same thing. Look, I don't live a very low carb diet personally because I'm very athletic. I go to gym 1 to 2 hours every day. I need some carbs, at least healthy carbs, so that I can perform at the gym. And for those people who will go to a party and they know they are going to end up eating something that they wouldn't normally eat, for them, yeah, take an extra walk, especially after meals. I do that with my family every evening. I after a dinner, going for a walk is the greatest thing. Most of the time, what ends up happening is people, especially that's why I told you, like, when people are older, it's harder. They'll say, "Oh, I have a back pain, I have this pain, I have that pain." People like to give excuses, but I tell them, look, there's so many things you can do. You don't have to even get out of the house. You can do home exercises. You can do water aerobics if you have a pool. There's so many things you can do. Yes, activity, exercise is the best way to be able to prevent insulin resistance and blood sugar spikes. If you use the glucose, there is nothing to turn into fat. Simple as that. You use that to your advantage. Now, it's not to abuse. Sometimes people will say, oh, yeah, I'll eat this whole cake and I'll go exercise. Well, exercise is overrated. So you will burn 300 calories in an hour, but you will eat that 300 calories in less than 5 minutes. So you have to be careful there. So exercise is not a replacement of a good diet, but yes, if you had something extra that you wouldn't have otherwise, go for a little walk, go do something extra to remedy that problem, but don't use the exercise to deceive yourself to say that, oh, I'll exercise. Well, first of all, if you eat a lot of carbs, you will feel tired. And it's very unlikely for you to go for a walk after that, right? So I'm telling you that that exercise can be a backup, but you should not use as an insurance for yourself to tell yourself that, oh, yeah, I'll exercise. But yes, you did something that you know you were not supposed to. Now you feel like guilty about it. Okay, sure, go ahead and exercise. That will definitely help. Now, from a supplement standpoint, I tell a lot of my patients, look, we have this SugarMD Advanced Glucose Support, which works great to prevent the blood sugar spikes. It's totally natural. But of course, I don't want you to keep taking that necessarily. So if you're on a low carb diet, you don't have to keep taking it. But if you are eating some carbs, incorporate that to prevent the blood sugar spike, which helps great. And even for herbal and supplement world, we don't necessarily although I'm selling it, I'm not pushing them to say, oh, yeah, you have to keep taking this. No. If you're on a good diet, you're exercising well, your numbers are good, there is no point of taking anything extra. Well, on the other side, yes, there's certain things, certain herbs can help you in other ways. Taking a small amount daily will help, but again, supplements are never a replacement for a good diet and exercise. I always tell them that even you think you're taking natural supplements, that's not a replacement for your low carb healthy diet.
You mentioned your supplement there, but what about things that people already have around the house, like apple cider vinegar or taking cinnamon with the meal? Any specific hacks, things people already have in their kitchen that they can use?
Definitely. That I have videos about these all the time. So they can mix up whatever they want in terms of elixir. I give elixir examples in my videos. But for example, using hot tea after dinner and adding some Ceylon cinnamon, which is better than a regular cinnamon. Regular cinnamon has a lot of drawbacks to it, especially if used excessively. But Ceylon cinnamon is much better. You can use turmeric if you're okay with the taste, but Ceylon cinnamon, some apple cider vinegar, not too much, just 1 tablespoon, and you can use olive oil together with that. People think that it may be gross actually, but it's not. And on your salad, why not make a habit of putting lemon and apple cider vinegar, which is the essence of every Italian dressing. That's a Mediterranean diet right there for you. So if you don't want to make drinks and stuff like that, make sure you incorporate those things to your daily diet, your lemon and your apple cider vinegar, which gives you vitamin C. Apple cider vinegar gives you vitamin C, a lot of antioxidants. Because with diabetes, you have a lot of oxidation, a lot of damage to your body. So you have to bring in all the antioxidants to negate that damage. But to your point, incorporating those things into your diet is the best way to go. Now, some people will say, no, I didn't grow up with this. I cannot put vinegar in anything. Okay, well, get some gummies maybe, and that's not going to hurt you. But naturally using in the diet, I have patients from India. They'll say, "Oh yeah, I know there's a bitter melon in your supplement, but we eat bitter melon." I'm like, "Great!" And they'll tell me that when they eat bitter melon that night, next morning their blood sugars are great. Yeah, so use everything natural to your advantage to make sure that you are giving your body a chance to recover from other antioxidant damage.
How do you feel about the order we eat things? So if you're going to have, say, a potato as part of your dinner, having, say, the salmon first, then the broccoli, and then putting the potato at the end of the meal, talk about how that impacts blood sugar.
One thing that I like in American diet, that when you go to a restaurant, they serve you salad first. And then by the time of the main course, you're like, oh, well, maybe I'm not going to order the main course. Because when you have a good salad before your meals and a soup, you will be full. So if you start every meal with a nice soup, a healthy soup and salad, you will realize that you don't really need that extra steak and potato that you would eat otherwise. And that is the perfect example of a plant-based diet, because you're filled with mostly vegetables and you didn't have to put extra protein or extra fat in your body that has to be processed, and that helps with the weight loss and so forth. So yes, the order of things, your appetite. Well, that's why we always, even dessert, right? You want to have a dessert? Yeah. Even your parents will tell you when you're a 2-year-old, don't eat the dessert in the beginning, because if you leave it at the end, you may not want to eat that dessert. And that's a very well point that everybody should practice, that leave everything that you want to eat right now to later, and maybe more than likely you may not want to eat that.
And correct me if I'm wrong, but I believe even adding fat and protein, say you're going to have just a potato, but adding, a bit of butter to that, or adding some fat and protein
Will
will
slow down the
alter
spikes.
how quickly that spikes, and it won't spike as
Right.
quickly.
Correct. Because any fat actually in your body, let's say you put a lot of olive oil, that's what I tell my patients, put all the olive oil you want on your salad, and that will slow down the absorption of anything else, because any fat in your stomach will slow down the process of absorbing anything that includes the carbs. So yeah, if you're gonna eat a carb and you eat fat and protein first, it'll definitely help prevent the spikes.
If you enjoyed that clip, press here for the full episode. I'll see you over there.
It's never too late, but the earlier you start, instead of postponing, the better to reverse diabetes.